Hello and welcome back to Easy Medics Daily. Today, we're going deeper into maternal health. Not just the numbers, not just the facts, but the stories that show how every life matters. Unsafe abortion is one of the hidden killers of mothers worldwide, and nurses are the unsung heroes saving lives daily. So if you care about mothers, families, and communities, make sure to subscribe and turn on notifications. Let's get into it. Every year, millions of women face unsafe abortions, often in silence, often in desperation. This isn't a comfortable topic, but it is a critical one because it represents a silent epidemic that claims far too many lives. When we say unsafe, we're really talking about procedures performed by individuals without the necessary skills or in an environment that doesn't meet minimal medical standards. Think about it. Unqualified providers using dangerous methods, from sharp objects to toxic substances, leading to devastating consequences. The results are heartbreaking. Severe bleeding that can't be stopped, raging infections that overwhelm the body, permanent infertility, and, all too often, death. So, why does this keep happening? The reasons are complex and deeply rooted in societal issues. First, there's a significant lack of access to safe, modern family planning. When women can't control the timing and spacing of their children, they may resort to desperate measures. Second, the heavy stigma and cultural silence surrounding abortion force many women into the shadows. Fear of judgment, social exclusion, or even legal repercussions makes it impossible for them to seek safe care openly. Finally, many health systems, particularly in low-resource areas, are simply too weak. They lack the supplies, the trained personnel, and the infrastructure to provide safe post-abortion care, which is crucial for managing complications. Knowing the warning signs can be the difference between life and death. If someone experiences severe abdominal pain after a procedure, it's a major red flag. Heavy vaginal bleeding, especially with clots, is another urgent signal. A high fever combined with a foul-smelling discharge points to a serious infection spreading through the body, and feelings of extreme weakness, dizziness, or fainting indicate significant blood loss and a state of shock. These are not symptoms to ignore or wait out. They are medical emergencies that demand immediate attention. If you see these signs in anyone, you must get them to a health facility right away. When a woman reaches a clinic or hospital with these complications, the medical team has to act fast. Treatment often starts with emergency care. Powerful antibiotics to fight off infection, for fluids to stabilize blood pressure and rehydrate the body, and medications to help the uterus contract and stop the bleeding. In more severe cases, where there's internal damage or retained tissue, surgery may be necessary to clean the uterus and repair any injuries. But medical treatment is only one part of the solution. Just as important is compassionate counseling and providing access to safe post-abortion care and contraception. This isn't just about fixing the immediate physical problem. It is about providing emotional support and empowering women with the tools to prevent a similar crisis in the future. The ultimate solution, however, is prevention. Accessible family planning, comprehensive education, and open, non-judgmental conversations are the most powerful tools we have to stop this silent epidemic. Let me share a story that brings this reality into sharp focus. In a rural community in Kenya, a young woman, let's call her Amina, found herself with an unintended pregnancy. With no access to a proper clinic and terrified of the stigma, she sought help from an untrained local provider. Days later, she developed a raging fever and severe abdominal pain. Her family, not understanding the cause, tried traditional remedies. By the time she was finally taken to a distant hospital, she was in septic shock. The infection had spread throughout her body. The doctors and nurses fought hard, but it was too late. Amina's life could have been saved. Access to safe care, a simple antibiotic, or even just information could have changed her story. This isn't about politics. It's about saving mothers, daughters, and sisters. It's about basic human health. This is where our frontline heroes, the nurses and midwives, step in. They are so much more than just caregivers. They are the guardians of safe motherhood, the lifesavers working tirelessly on the front lines. Their role is multifaceted and absolutely essential. They educate pregnant women about proper nutrition, the importance of supplements like folic acid and iron, and why early and regular antenatal care is non-negotiable. They are masters of early detection, meticulously checking blood pressure, testing urine for protein to screen for preeclampsia, and spotting the subtle signs of complications before they become life-threatening. When emergencies strike, nurses are the first responders. During a postpartum hemorrhage, they act with lightning speed to manage the bleeding. When a mother develops eclampsia, they administer magnesium sulfate to prevent deadly seizures. In cases of infection, they start antibiotics immediately. Their quick thinking and skilled interventions save lives every single day. Beyond the clinical skills, their role as a source of emotional support is immeasurable. They hold hands, offer words of encouragement, and guide mothers through the intense physical and emotional journey of childbirth, creating a safe and reassuring environment. Their work extends far beyond the hospital walls. Many nurses conduct community outreach, traveling to remote villages to provide care, educate families, and collaborate with traditional birth attendants, bridging the gap between traditional practices and modern medicine. Let me tell you about a nurse in Nairobi. During a routine antenatal visit, she noticed a young mother's blood pressure was dangerously high, a clear sign of severe Without hesitation, she administered a life-saving dose of magnesium sulfate and arranged for an immediate emergency transfer to a larger hospital. Her swift, decisive actions saved not one life, but two. Nurses are not just doing a job. They are advocates, teachers, and guardians. They are the backbone of maternal health. In our next video, we'll explore the power of communities, culture, and the hidden risks that quietly take mothers' lives. How can families, villages, and traditions either protect or endanger a mother? Stay tuned. This is the final battle for maternal health. Thank you so much for watching, and if you found this valuable, please like, share, and subscribe. See you next time.